We all welcome to our beautiful State House. We have good news. We're making great progress. When the COVID-19 virus hit, South Carolina chose a wise approach. It was carefully targeted and factually based, and it worked. It was a deliberate, careful approach. This is the same approach that we have been and are using on vaccinations. Our priority was and is to save lives. That was our focus. Our moral and ethical duty was to first protect those at greatest risk of dying from the virus and protect those who keep them and the rest of us alive. That group included hospital and healthcare workers, first responders, residents and staff of nursing homes and long-term care facilities, and our seniors aged 65 and up. In the month of February, South Carolina made tremendous progress on expanding access to the vaccinations. As the supply of vaccine increased, new shot locations opened every day. Our hospitals, pharmacies, and healthcare providers became more efficient at getting large numbers of our seniors registered and vaccinated. By staying the course and resisting the loud distractions and potential disruptions, over 1 million South Carolinians have now received the vaccine. Because of these successes, we are now in a position to make the majority of South Carolinians eligible to receive the vaccine. We are ready to enter what is referred to as Phase B, which is the next phase. Starting next Monday, March the 8th, individuals in the following groups will be eligible to make appointments to get vaccinations. And if there's a space available, they can get that vaccination that same day. Individuals age 55 and above. Individuals age 16 to 64 with high-risk medical conditions, including but not limited to the following: cancer, chronic kidney disease, chronic lung disease, diabetes, Down syndrome, heart disease, hypertension, HIV/AIDS, organ transplant, obesity, pregnancy, and sickle cell disease, among others. That's for 16 years old and above. Also included are special needs persons who have developmental, physical, or other severe high-risk disabilities that makes developing severe life-threatening illness or death from COVID infection more likely. Also included will be frontline workers who perform a job in which they are at increased risk of exposure due to their frequent, close, and face-to-face contact with others in their work environment. A few examples of these workers included are these: K-12 and higher education, health care, child care, law enforcement, criminal justice, manufacturing, hospitality, transportation, service, agribusiness, retail, local, state, and federal government employees, and group homes, among others, as will be described by Dr. Summer. Also, I am asking any state resident who has made multiple appointments trying to get vaccinated, if you have already received your vaccination, please go back and cancel out the future unneeded vaccination appointment, so those appointments and that time and that vaccine can be freed up immediately for others who have not yet received their vaccination. Finally, on schools. A few weeks ago, I directed school districts to finalize their vaccination plans with their local health care providers and to submit them to Superintendent Spearman and the Department of Education for review. Superintendent Spearman and a team have worked to verify each school district's vaccination plan so that our teachers can be vaccinated as quickly and efficiently as possible, as mentioned above in 1B. Many local health care providers and school districts have planned to conduct teacher-specific vaccination clinics. Held on school grounds on weekends, afternoons, or at specific times, these coordinated clinics will allow teachers to be vaccinated quicker than if the teachers had to make their own individual appointments. Superintendent Spearman will describe that further in a moment. Finally, we know that students have lost significant learning progress due simply to being out of the classroom. It is clear not only in South Carolina, but all over the country. Parents should not have to choose between their jobs and their children. Parents must have the option of sending their children to school 5 days a week, face-to-face instruction. That is why they pay taxes. Our schools must, I repeat, our schools, all of our schools must open 5 days a week. I've repeatedly asked the General Assembly to send me a bill requiring schools to offer all parents the option of in-person 5-day-a-week instruction for their children. They must have that option. Today, I repeat that request to the General Assembly. There are no more excuses or justifications for every one of our schools not to be open 5 days a week for face-to-face instruction. The consequences of not doing that are immeasurable. Our schools must be open. Now I'll ask Dr. Summer of DHEC for his remarks.
Thank you, Governor. I appreciate that. Good morning, everyone. Thank you for being here. It's very happy to be able to start to open our vaccine program up to more and more South Carolinians. As the Governor said, we will now be able to vaccinate more than half of all the people of South Carolina as of Monday. That's a very giant step forward for us. And I want to recognize the fact that we're here today because of the great work of so many people. So let me just briefly thank all of the providers out there, all of the pharmacies, the hospitals, the volunteers. The Governor and I were in Spartanburg yesterday at the College of Osteopathic Medicine there, and a lot of volunteers working in their clinic, helping to make sure every South Carolinian has a chance to get this vaccine as quickly as possible. We've been moving through the folks in 1A, our medical providers, and those who are 65 and over at a good pace. As we've gotten more and more vaccine, we've been able to speed up that process, and as you heard, we've now been able to give more than 1 million doses of vaccine out to the people of South Carolina. As a result of that, it is now time for us to move to 1B. 1B is a large group. We have about 2.7 million South Carolinians in Group 1B. So again, that will really take us forward and get us closer to the herd immunity that we seek, which is 70 to 80% of the population of South Carolina being vaccinated. So this is, again, a big step forward. Thanks again to everyone who's made this possible. A couple things I would note is that, we do ask people to still wait their turn in line. If you're not in the 1B group, please don't jump ahead. Please wait, because we are really focusing on the science as we put this plan together. And what we are working on here is identifying those people at the greatest risk and vaccinating them first. If you've seen the chart that shows the people who've died from COVID here, and tragically, we've lost already more than 8,000 South Carolinians to this disease. The vast majority of those who've died were over the age of 55. So by adding the age 55 group into 1B, we're going to be able to address that. At the same time, we are still going to continue to focus on vaccinating those who are 65 and over and making sure every single person in that group has the opportunity to get the vaccine as quickly as possible, with the goal of saving as many lives, avoiding as much serious illness, as many families suffering loss as we possibly can. So with that, we are very much focused again on the science, on identifying those at the greatest risk, and then working our way through those at a little bit lower risk, those with younger folks but who have significant exposure on their job, who live or work in a group setting, so that we can make sure that we do the right thing for every South Carolinian. And our anticipation is that by summer, every South Carolinian will have had access to this vaccine, and hopefully we'll be very close to herd immunity by then. And with that, we can start to return to normalcy, and really focus on not having to wear the mask and do the social distancing. Let me emphasize, though, that for now, we do need to still take those safety precautions. Even if we've been vaccinated, still need to wear the masks, still need to social distance, still need to avoid large groups to keep everyone in South Carolina safe. You're not only protecting yourself when you do that, but you're protecting your family, your friends, and all the people of South Carolina. In South Carolina, we have a well-deserved reputation for taking care of each other. I think the past year has certainly shown how well we do that. And if we can just stick with this for a few more months, we're going to get there, and we're going to defeat this. And with that, I'll turn things over to the Superintendent.